So the integration in healthcare means getting rid of the silos that we have within medical care, but even more importantly between oral health and medical care. And we have a lot of efforts that we need to do there. The panel that we had today from the consumer perspective really indicated that consumers want that integrated care. So we as professionals in oral health and medical care need to be taking the steps to move that ahead.
I don't think we can look at the end result without looking at the beginning result. And I think medical students learning more about the mouth, dental students learning more about general health in school, and then having the experience of learning together in residencies that are designed for integrated care will make an enormous difference.
You know, there's really two parts of a person being healthy. Number one, if we work and they become healthier, they're better off, and they're going to have a lot better life and a longer life and a more enjoyable life, but they're also going to have, from an economic standpoint, a more productive life. They're going to be part of a productive workforce. It's going to encourage business to come to our communities where you have that kind of healthy population to locate, because they're going to have a workforce that will show up for work every day. They're going to be healthy. They're not going to be home because they're sick. They're not going to be home because their kid is home and can't get to the doctor and can't go to the doctor. So it really has more than one meaning. It's obviously a moral issue in some aspects to me, because I happen to believe that every single American deserves quality, affordable health care. But it's also an economic issue, and it was when I was governor.
10 years, we'll be at a point where all specialties are working together to treat the individual's condition, which I think is a theme we've heard a lot in this conference today. So whatever the issue is that that individual is facing, everybody that can impact that issue is at the table discussing the best way forward for that individual patient.
I think it's been really exciting for me as a journalist and somebody who spends a lot of time thinking about oral health to have a chance to hear experts from the larger world of healthcare talking about really important principles like value-based care and equitable care, and even bringing joy back into a healthcare setting and practice so providers don't get burned out.
I think the Leadership Forum has been a great exercise in bringing stakeholders together to talk about the issues that they all see from their particular vantage points. It's really nice to be able to be in the same room with a lot of people that sometimes you talk to on the phone or sometimes didn't even know exist, to be able to talk about common problems and hopefully come to some solutions.